Who else has who else has laptop? Anyone is having laptop? The most important is classification. The most important classification is ischemic stroke
Big stroke.
and hemorrhagic stroke. The most important part of hemorrhagic stroke is happens in only 18% of the people. But whenever it happens, which is 18% of the people, we do not. So So we do not know who is the next 18% of the people who will suffer from stroke and what are the situations we are going to face in the stroke. Now, up to now, the studies were very simple that the things can be recovered, cannot be recovered after having stroke. Most people think that stroke होने के बाद recovery नहीं आता. Everything is like a myth when you enter the field of paralysis. ऐसा लगता है सब बर्बाद हो गया, सब कुछ खत्म हो गया. एक लेवल के बाद ऐसा लगता है कुछ भी नहीं हो सकता. Even I think Naman is there today. Naman is there? No.
Hmm.
So Naman referred me one case of maybe 12 years old case, right? Is in a vegetative stage. So I just said, see, brain is such a mechanism which can be reconstructed, redynamized, remechanized, and lot of the scope is there inside the brain. Only probably हम लोग को रास्ता मालूम होना चाहिए कि हम लोग क्या क्या कर सकता है. ब्रेन के पास सारे रास्ते खुले हैं. All the doors are open in the brain. Yes, there are certain things which cannot be done, but there are certain things which can be done, and the life and quality of the person can be. Most important part is whether the things can be improved or not. This can be illustrated after we understand the pathology. The most important part of any disease is that if you take care of it at the evening stage, then the lateral stage difficulty you don't find. Always think that the exercise is always the solution of the problem, but we defocus ourselves from what is going on. And when it becomes a very difficult stage to recover, at that time when we enter the medical field to revive it. It is the only problem of our thought and our process by which we don't understand the complexity of the disease. The most important part is the complications which we are going to face. So we just test a case and we feel that there is no complication. Now we will face nothing. Everything is as it is. Then you are in a very difficult situation. You'll find that things are totally different when you see whenever you see the strokes or any function damage or neuromuscular disease happen because we don't have a plan of recovering those problems. The plans are absent and that is why we cannot adhere to any planning. For example, people were asking me, sir, why different pains are required, why different stimulations are required. First question is, why stimulations is required? Stimulation is a communication established inside the brain. Now, why do we need internet? Internet is a made of communication. So various level of internet, various programs, various things make you what? Connect with various ways. You cannot expect WhatsApp to become Zoom class and Zoom cannot be expected to become WhatsApp class. Can it happen? Can WhatsApp become Zoom and Zoom become WhatsApp?
No, no, sir. No.
So when this cannot happen, then we should understand that different things are required for different recovery at different levels.
Indeed.
So those who really want to do anything in any level, they have to build up their ways, understanding, and methodologies to come up with those sort of relationship to establish and to work out. So today we understand that yes, the recovery is possible, the things are possible, and the recovery is very much accessible, and we can do a lot of things to recover the people. Yes. So whenever we speak about brain stroke, let us come to the topic of brain stroke. In brain stroke, when we speak the brain, it is called as alternate brain name. What are the alternative names of the brain? It is the bleeding in the brain, brain hemorrhage, stroke hemorrhagic, and hemorrhagic cerebrovascular disease. So we call it CHD is also coronary heart disease, but also we call it HCD or CHD, cerebrovascular hemorrhagic disease. So the different names what we call for bleed of the brain is brain bleeding inside the brain, where it's a rupture of the artery, right? So it is a hemorrhage inside the brain, stroke hemorrhage, and hemorrhage of cerebrovascular disease, right? So this has been given some four alternative names. So here you can see the arteries. This is the middle cerebral artery. This is the anterior cerebral artery. This is the common cerebral artery. This is the posterior cerebral artery. This is the vertebral artery. The hemorrhage stroke occurs when a blood vessel bursts inside the brain, and 20% strokes are hemorrhagic. So I already told, out of total strokes, when the vessels burst inside the brain, it is called a hemorrhagic stroke. There are two types. One is subarachnoid hemorrhage, one is intracerebral hemorrhage, ICH. So here you can see the bleed is happening, right? So there is a rupture inside the brain, and here you can see the bleed is coming out from the brain. So this is called hemorrhagic bleed. So it is intracerebral hemorrhage and it is subarachnoid hemorrhage, SH. SCH. There are two types of hemorrhage. What is called intracerebral hemorrhage and subarachnoid hemorrhage. There are two types of stroke. What are they? ICH, intercerebral hemorrhage, and subarachnoid hemorrhage. There are two types of bleed. So here you can see this is a in the subarachnoid space. So this is a subarachnoid space. So this is the subarachnoid space, right? So when the bleed happens here, what you can see here, this is a subarachnoid space. When the bleed happens here, it is called what? Intercerebral hemorrhage or subarachnoid hemorrhage. Why it is not going down? 1 minute. Yes. Okay. I got it. So worldwide status. So see, that is why I always say why it is a very big market, because 15 million suffer stroke each year. So if you see, by the time when we complete our talk in Hyderabad, only more than 20, 30 people go in stroke. And this is a overlap market. This is a very big market, which we say paralysis is still a big market, and we do not know how to overcome paralysis. We know how to control the brain anatomy. When we know how to control the ICH, we do compressive decoy anatomy. We do all these things, but we do not know how to overcome this situation. Stroke management and good system, when we adopt, then only we can be able to overcome this situation. Once we have a stroke, we have a permanent disability. This disability we try to always overcome by with the help of exercise. We always believe exercise is a cure to a disease, right? But then we forgot exercise is its own limitation. It cannot be a cure of everything. Our only problem in our mind thought is that exercise is a cure, right? Do exercise, and continue to do exercise. But after certain times, stop responding to this, all types of muscle exercise, equipment exercises, occupational therapies. Why? Because the question is, it is on resistance level. Once it's developed its resistance level, एक रेसिस्टेंस होता है उस ब्रेन का, अगर वो डेवलप कर ले कि नहीं, आई विल नॉट वर्क आफ्टर बियॉन्ड दिस एंड आई एम नॉट गोइंग टू रेस्पॉन्ड आफ्टर दिस, so you cannot make it work, and that is called permanent disability. So most of the people who sue in paralysis and hemorrhagic stroke or any other thing, they go under permanent disability. So for ICH, intracerebral hemorrhage, so the causes are trauma, infections, tumors, blood clotting deficiencies, abnormalities in blood vessels. So most important part is when we see this abnormality in blood vessels, and SA subarachnoid hemorrhage, we see is the aneurysm. Aneurysm is the most important part of the, what you call, the part of subarachnoid hemorrhage. So the ICH is trauma, infection, tumors, blood clotting. So suddenly we have seen Mahesh Dhoni, our MS Dhoni. MS Dhoni has come to an opinion that yes, be fast. So it is not be fast. It is a warning sign of what? Seeing. So what are the things what we have to see? Is trouble in seeing in both eyes, sudden confusion, sudden trouble walking, dizziness or loss of coordination, severe headache with no cause, sudden numbness or weakness of face, arm, leg in one side of the body. This is what we said. So think fast, act fast, or find sign of the stroke. So why we call it facial weakness, arm weakness, speech difficulties, and time in brain. So this is what the act first or the sign of stroke. So whenever you see this type of weakness, you understand that the patient is suffering from what? Stroke disease. So whenever you see the patient suffering from stroke disease, you can understand that what is your first thing? Think fast, act fast. So this is the formula. So fast means what? Facial weakness, arm weakness, speech difficulty, and time in brain. So if you take the steps in first 4.5 hours, by giving first TPA, So the patient can you can preserve lot of cells from death and deficits. So this is the most important part which we understand that act fast is a very fast sign of the recovery and it helps you to recover the patients in a very proper way in a faster management. So here the most important thing is face, arm, speech, and type. So that is why it is called fast. Whenever difficulty in speaking, and at that time is important. The sudden arisal of these symptoms may destroy the case. So what you have to do? You have to act as fast symptom of the patient. So what are the neurological examinations are there about which will give a good lecture about in the future class? What is the neurological examinations? CT scan, you have to understand how to see a CT scan in the hemorrhagic stroke. MRI will speak to you. CBC, blood time, protein time, PTT, cerebral spinal fluid examination are the most important thing which we have to see.
अरे सुख शांति कल सैंपल निकाल के तुम्हारा ले जाए शाम तक रिपोर्ट आ जाए अगर वायरल है तो नहाएंगे टाइफाइड आया तो नहाएंगे अच्छा ऐसे स्पॉन्जिंग करना है हाँ हाँ
Please mute your microphones. Please mute your microphone.
So here you can see the on the this is the brain angio. This is the brain angio. This is called the angiography of the brain. Oh, it's drawing. I don't want drawing. So here you can see this is called the angio of the brain. This is the CT. Here you can see the hemorrhagic stroke over here. And here you can see the ventricles and they are dilated in nature. So when you can see the dilation of ventricles and all, you can understand the patient is suffering from a serious and difficult problems. So there are three things here. This is a immediate treatment that is called TPA and all. Then if there is a midline shift or something like that to remove the hemorrhagic part, keratotomy and keratoplasty or internal decompression is done. And long-term treatment, we know it's the integration of treatment. This is the most important part of this case. We understand that short-term is not the treatment of any paralytic patient. It's a long-term case. And if you don't know how to start this case, this is the most important part is the long-term treatment of the patient. This long-term treatment is planning. What it needs? Planning. So I already told you what is the planning. We have to go in a proper way in which we have to systemize the functional disability of the patient. अगर patient को बहुत सारा प्रॉब्लम आ चुका है, पैरालिटिक हो चुका है, फंक्शनल डिसेबिलिटी जिसको हम बोलते हैं, उस फंक्शनल डिसेबिलिटी को रिवाइव करने के लिए you need this type of treatment and it is a very good type of treatment. So here you can see the most of the difficulties which we encounter in this is permanent loss of movement of sensation of a part of the body. It can be both motor and sensory deficit. Joint contractures because the muscles are having a non-proper mobility, so contractures will develop up to grade 4 spasticity. Grade 1, grade 2, grade 3, grade 4 spasticity is developed during physiotherapy sessions. And then again, it becomes difficult with botulinum, Botox injections. Sometimes we overcome, sometimes we do not. But here we have encountered lot of spasticity. Tomorrow will result a patient who is over 80 years and we have reduced spasticity from grade 4 to grade 1. So the lifespan also decreases, the decreased ability to function or care for self, and there are a lot of things. And most important part of all this disease is that urinary and respiratory tract infections they continue to take place. High blood pressure, smoking, cocaine, and alcohol. So always we say Indian curry made of spice like turmeric, it helps you to reduce the hemorrhagic stroke and which is the most leading cause of adult disability. So in adult cases, जितने में उम्र से बुजुर्ग लोग होते जाते हैं, after 40, you will see the cases are more. But even now in youngsters, we are seeing these cases are coming up. So this is a piled up case, right? So in this piled up cases, we should understand that what is the mechanism of recovery. Until we understand the mechanism of recovery, we cannot recover the patient. The mechanism of recovery is the repairing of tracts. So whenever there is a lack of communication between the hand and the brain and the leg and the brain and the sensation signals are not proper, you understand that we are suffering from lack of communication in the brain. There's a disruption of communication, and after every 45 second per second, someone suffers from stroke, and every 3 minutes, someone dies from a stroke. More women than a man die out from stroke. Third most cause of the death locally is brain stroke. And almost half of the people with subarachnoid hemorrhage die before reaching the hospital. So that is the biggest problem we are having right now. That most of the people who are suffering from subarachnoid space, emerge in the subarachnoid area with aneurysm, they suffer from what? Stroke. So here you can see we have completed very easily about the major part of the brain stroke. It is called SH, subarachnoid hemorrhage, or what? ICH. And whenever there is a hemorrhage, there is a midline shift. Whenever there is a midline shift, you see the brain edema is there, brain swelling is there. So we have to take up all the necessary work module to recover the patient. The most important part is the functional recovery. Once the patient is discharged from ICU, the most important part we understand is the functional recovery, the recovery of hands and the leg. So whenever there is a damage of any of the issues inside the brain, you lose the sensation of working with them. You lose the muscle communication, you lose the leg communication, you lose the, it all results to all type of disruptions of communication. And because of disruptions of communications, you see the people suffer from various complications, various issues, and that is the reason why we are not able to overcome paralysis because we have never made a planning to overcome paralysis. There should be a very good planning, very good status of planning, and the most important part of recovery is the functional recovery. Without functional recovery, there is no important part of recovery inside the patient without deficit. And definitely non-invasive brain stimulations and all, they played an important role because they tell you which area has to be located and which has to be supplied what. So it is a part of TTCS. So we have mixed live navigation transmagnetic stimulation, RTMS, rapid transmagnetic stimulations, and TDS, trans-direct current stimulation. So that is the place where we have to understand that when you have worked with all these things in the brain, you have to understand that there are only two or three devices, out of which the best is live navigation transmagnetic stimulations. We could assess the maps. Hmm.
सर वो कि फार्मेसी की शॉप को हैंडल करने की सत्यनारायण को बोल रहे हैं
ठीक है तो ये
इधर रखना
हाँ। लावण्य को दे दो
लाओ
ठीक है
थैंक
सर So most important part we have understood that recovery is very good functional recovery, which is developed from functional deficit, can be recovered very well only when we take a proper initiative, proper planning. If our proper planning is not there, if our first step is not correct, definitely the second step cannot be correct, and third step is not at all correct. So first step, second step, third step, fourth step, if currently taken in a proper way, I'm sure anything of any complications, any problem can be over. It is only our approach which teaches us that there can be recovery. It is only our approach which teaches us recovery is difficult. Because if we make the things more and more difficult every day, the things will become more and more difficult every day. And if you try to make the things easy every day, it will become easy every day. So that is where we can understand recovery is very important in a systemized and proper way. If we can take systemized and proper way, एक सही रास्ते पर चलने से कहीं भी सही मंजिल मिल जाती है पर अगर हमारा रास्ता ही सही नहीं होगा if our the road is not correct और रास्ते पर चलना ही नहीं आता होगा तो हम किसको जाके क्या करेंगे और कहाँ पहुंचेंगे ये बताना आज मुश्किल है इसलिए there is a saying if you don't have a correct path to understand what is recovery, how to bring that recovery. And if you are so anxious to do that, all these things in not in a proper way, then you are going to suffer from a better and longer disease. Otherwise, and things becomes proper in future. You may ask your questions. You may ask your questions. Ask your question, please. Yes. नहीं आवाज नहीं समझ में आ रही मेरा आई could not hear you. Please tell me. शिवानी क्या बोल रही है
Sir, ma'am is not audible. Can you write the question in the chat box?
Madam, stroke happens because of our lifestyle. We never have taken care of our lifestyle. When we are young, we are addicted to smoking, bad lifestyle, bad food. All this happens over in half knowledge. So all these things destroys our life. It is said in Hindi, chinta chita jalati hai. So chinta, stress is the most important part, oxidative stress. इसलिए बोलते हैं चिंता चिता जलाती है. You yourself burn your body with a lot of stress. Otherwise, these things are not required. You can focus and you can do things in a better
Excuse me, sir. I have a question, please.
way.
Sir, some patient complain that uh, half part of their body uh, is vulnerable, but not paralysis, but very much vulnerable to sensation and something like this. Is it due to a stroke, brain stroke?
शिवानी क्या बोल रहा है ये
Are you talking about hemiparesis? Not
Uh,
fully paralyzed, but body is having weakness. Are you asking about
yes, yes, yes,
hemiparesis? Okay,
yes,
sir,
yes.
he is asking about hemiparesis.
See, hemiplegia is one of the symptom of brain stroke, which is called CDA. So when we don't identify with this ischemic or any other type of classification of stroke, we call it CVA, cerebrovascular accident. We have already told you, Mira, what are the symptoms for paralysis. We call it fast. Face, facial deviations, then movement, then
arm.
disorient. Yeah, means lack of strength in the leg, and then disorientation. So he's not able to orient.
So
And most
what?
importantly, hemiparesis is a part, is a symptom of paralysis where both it is a stage ahead of flaccid. So first stage is flaccid, then comes hemiparesis. So in hemiparesis, you get good results in a better time, provided you act fast. So every day, whenever you have a stroke, in first 1 minute, you lose around 10.5 million cells. So you can understand how many cells we are losing every day for this type of diseases. So to overcome all these things, you have to act very nicely, very beautifully, and in a proper way.
So it's Dr. Sharat Pandit from Nepal. I want to ask a question. Why
Hmm.
there is high mortality rate in subarachnoid hemorrhage, sir?
Why is high mortality rate in?
Subarachnoid hemorrhage.
See, subarachnoid hemorrhage is having a high mortality rate because it's an aneurysm gene, right? So aneurysm is an area where you can see there is always a bulge of the artery. So whenever this bleeds, there is a massive edema inside the brain. So brain starts swelling, and the CSF which is inside the brain also the supracellular systems, because of the edema inside the brain, it presses out the CSF inside the brain. As a result, midline shift is kept on shifting, and during that period is surgery and doctor now. See, there is something called first and we have. It is very difficult for you to understand. Don't go with all these Facebook commentaries, putting blood here, there. Yeah, all these things are not the right solution to the problem. The right solution is the TPA. So the moment you identify there is a stroke, immediately rush to the hospital for getting TPA. For example, when you see there is a compressive myelopathy, myelomalacia, please either allow the person to go for surgery or you don't insist for physiotherapy alone because there's a nerve compression, cord compression, and the tissues inside the cord are damaging. So we have to take care of all the situations and issues before recovery of the patient. See, migraine and all, have to identify why there is migraine. First of all, it is migraine or stress headache or cluster headache or any other headache, we have to identify. So greatly, my sister will give a talk from Italy on headaches. She's the head of the department of headache clinic. So she will identify and she will tell you which kind of headache do you have. Is it stress headache, cluster headache, uh, brain stroke? So there are many factors which you will find in that.
So you have said that numbness
No.
is the main cause for the many type of strokes.
No, 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 no. Numbness is a symptom of the stroke.
Yeah.
Numbness is not the kind, cannot be the part of the stroke. It is inside the brain.
Hello.
So after the death of neurons, when the receptors do not receive receiving signals, and when the receiving signals are not processed properly in a proper way, then there is a sensory deficit. I have never said in this any of my lecture that being any studious person will not say you that hemorrhagic stroke will destroy the life of man.
if I get that, if we get that symptoms often, is it a cause for future hemorrhage or like
You first go for if you
getting
to find that.
symptoms of numbness?
See, there are many reasons for numbness. Even the spondylitis leads to numbness, right? Firstly, you have to identify whether you are numbed or not. So it's second, we have to see if there is numbness. Then the biggest problem is uh, what you call sensory deficit. Your sensation of feeling in the fingers reduces. So when there is such a thing, it is very difficult to say whether you are really suffering from paralytic stage or non-paralytic stage, or it is because of the nerve compression in the spine or not because of the spine, or it may be a localized problem. All this is to be investigated and find out why the person is having numbness.
How to stop that numbness, sir? Whether regular exercise?
Numbness cannot be stopped. It has to be treated properly. We have seen those patients who have got with complete numbness or complete sensory deficit. If you see them properly, you will be what you call. You will get fear that how to recover a paralysis patient, and that fear is also in the eyes of a doctors. So when they operate the brain, they always say the risk of operating a brain is much more difficult and accessible than a what you call recovery of the patient. So that part we have to understand. The first thing is we need to have a recovery paralysis patient. Otherwise, destroying a case will never help us in our life to work for each other. Democracy. Democracy. So you have to go with the people's thought. The people's thought is that don't put too much stress, do your good exercise, good healthy living, healthy thinking. You'll overcome from this situation. That is why I always insist people you should buy pen, you should work hard from the day one itself. Because if you don't do all these things, you have only options. You don't have answers for the questions. If you don't have answers, who will hear your questions? You must know the answer of the situation. And so the answers of the situation itself speaks that the situation was the
I mean, stuck up again.
how a
Numbness,
disease
sir.
itself is a part of the disease. You have to find out. Symptom is a part of the disease. The disease will take how it was created. The moment you know how it was created, it can be destroyed in the same way.
Oh, thank you, sir. So one question is, how do you feel after your ill health, sir?
Hmm?
How do you feel after your ill health?
How do you feel after
Your ill health.
my ill health? I'm okay. I'm doing my active duty.
So take some good rest, sir.
We have to work. It's always rest is not a
हाँ, 3 दिन से नींद नहीं है और खाना भी नहीं है सर। इधर हैदराबाद में वर्ल्ड एक्यूपंक्चर डे सेलिब्रेशन किया सर, कल 24th में किया। उसका पूरा मैं ही देखा सर पूरा। उसका से पूरा मेरे को टेस्ट हो के माइग्रेन सीरियस आया सर। अभी कैसा हुआ बोल तो मेरा मैडम भी बोलते हैं मैडम। हेलो सर। हेलो।
tell me.
वही मैडम
Here
भी
is
अब मैं भूल गया, पूरा भूल गया के सर। एक एक घंटा तक मैं होश में भी नहीं आया। तो
ठीक है,
सीरियस
जो
हो
हुआ ठीक है, उसको टीआई बोलते हैं, उसको टीआई बोलते हैं। इट इज कॉल्ड
सर
टीआई,
इसको
इट इज नॉट
कुछ
ischemic stroke or any other stroke, it is called TI. So it is a intermittent stroke. It does not bring any deficit, but it is a warning signal for the new occurring of the stroke.
इसका पॉइंट कुछ है तो बताना सर। अभी भी ज्यादा पेन है